Become Your Loving Self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice located in Encino, California. And welcome to this program. I'm here with my colleague, my business partner, my very, very, very good friend, and my coach, my mentor.
Sounds great to me.
Sounds great to you, of course, Dr. Robert Jaffe, right?
Yeah.
Who's also a licensed marriage and family therapist and a certified hypnotherapist. And we are here to talk to you about the many wonderful qualities that human beings have, and also the roadblocks that stop us from seeing the goodness in us and the goodness in our partners or our spouse or basically the world around us, and to help you to overcome the many obstacles that life bring to us by by kind of opening up certain topics such as codependency and in my case human sexuality and sexual healthcare.
Sexual healthcare, that's a big one.
That's a big one. Yes, welcome, Dr. Jaffe.
Thank you, and I appreciate your wonderful introduction.
What is true.
And thank you. And yeah, we're here to try to help people understand themselves better, understand other people, and learn to have more love, appreciation, and gratitude.
Yes.
Developing an attitude of gratitude is so profoundly spiritual and helpful. The more gratitude we have, the more we get to be grateful for. And it's a very difficult thing to do when we're living in a world where people haven't learned that that's what they need to do. Most people focus on what they don't have, what isn't going right, and that occupies them. And that's the opposite of an attitude of gratitude.
Exactly.
Yeah.
Yes.
I'm trying to remember I can't remember. I'm going to look it up one of these days. It was maybe Winston Churchill or Federal FDR. They said, he said, never complain, never explain.
I like that.
Yeah. And why is that? Because complaining focuses on what you don't want, and when you focus on what you don't want, that becomes bigger inside of you, and also becomes bigger in the world. And when you explain, you're trying to justify. So all you have to do is state your truth and say, "This is my truth. This is what I think. This is what I believe." And if you disagree, that's fine. We can have a discussion about it, rather than I'm right and you're wrong, or worse yet, I'm right and you're horrible, right? And that's what's going on in the world right now.
That's what's going on. Yes, you're either with me or against me.
Yeah, exactly.
Yes, and that's not what humanity is about. That's not what kindness is about. That's not what compassion is about.
And it's certainly not what our democracy was founded on.
Right.
We were founded on the principle that we would have honest discussions, and that if we disagreed, we would compromise, and we wouldn't call each other names, and we would all be on the same side of wanting the best for the country as well as the best for ourselves. And unfortunately, we've sort of gotten off track. My wish, my hope, and my belief is that we will get back on track.
Yes. And that's one of our aims here, right? We cannot change the world. We cannot change many people. We cannot actually change anybody unless somebody decides that they want to change. And how that happens is by looking at themselves and identifying the areas that they are uncomfortable to them, and take a look at them and decide, you know what, I don't want this for myself. Mm-hmm. So either they have the skills to do that or they don't. If they don't, then if they are that aware, most probably they're going to seek help. And if they're not, so they're just going to continue probably with their discomfort. I don't know. What do you think?
Well, I think absolutely you're right. And I think that what I see a lot in the world and in my practice are people who are either introspective or projective. Introspective means that I'm going to look at myself to see what I can learn about myself that I like and that I don't like.
Mhm.
And the things that I don't like, I'm going to admit because I can't work on something when I'm pretending it doesn't exist. So I'm going to admit it to myself, and then I'm going to figure out how to get better. And I want to be a better person, so I'm going to look at myself. And then there's the projective, which is I'm going to look outside of myself. I'm going to look at you, and I'm going to say, well, if you were different, then I wouldn't be the way I am. And that sort of leaves me feeling powerless because I can't change because you're the way you are. And since I can't change unless you change, I'm going to put all of my energy into trying to get you to change. And that's what we see a lot in our therapy and our couples counseling is people blaming each other and not wanting to do the hard work of looking inward to see what they can do to make things better.
Exactly. And when it comes to couples therapy, one area that significantly shows up is, you know, a mixture of difficulty within their relationships and their sexual relationships. We know that we have said this before, and I'm going to say it again. For those who haven't heard of it, that when we look at relationship problem, we know there are sexual problem a part of it. When we see sexual problems, we know relationship problem is a part of it.
Well, yeah, because our sexuality is definitely a part of our humanity, right?
Exactly. Yes.
So
Yes.
now there are people who have relationships based on sex, and those are specific kinds of relationships where they attempt to not have any emotional connection. And it's certainly possible to have good sex without emotional connection, uh, but it's not going to be fulfilling in terms of other aspects of our lives, right?
Exactly. Yes. So our aim is to help our couples,
To help our couples
partners to understand where the challenges are and try to help them overcome those challenges by empowering, by awareness, by taking responsibility for their choices, and to help them, find a way out of the difficulties in order to have a lifetime full of joy, full of happiness and enjoyment next to each other.
Mhm.
Right?
Yeah. And when I hear the word responsibility, I think of it as two words, response slash ability, which really is the ability to respond to what's going on as opposed to react to what's going on. And what's the difference? When you respond, you choose how you wish to respond in that particular situation. What is how can I respond in a way that is helpful to the situation that doesn't make things worse? And reactions don't come from that place. Reactions come from usually old hurts and unresolved injuries, emotional injuries, and it's sort of like somebody touches our knee, and we have us, and our knee is bruised, and we just go ow, and when we reach out and we slap the person because they touched a place in us that's injured,
Yeah.
and that's a reaction. A response, if we had the injured knee and somebody touched the knee, we would say, ow, you know, that hurts, and please don't do that because my knee is injured. That's a response.
Yes.
Yeah. Rather than ow and reach out and smack the person, which is a reaction.
Which is a reaction. Exactly. And then, but we see lots of reactions.
We do.
We see more of a reaction than we see,
And then we see responses.
responses. exactly. And also, what we see is passiveness, right? And one of the areas that we see passiveness significantly is about sexual expression, difficulty in sex, right? And not knowing how to basically talk about sexual difficulties, how to uh, understand even sexual difficulties, because to talk about it first, the person needs to be aware of it and understand that they have a sexual problem or they don't, right?
Well, that's what we just were talking about as far as taking responsibility, yes. Meaning admitting that you have a problem.
That you have a problem. But to know that you have a problem, you have to have some background knowledge about it, or you have to have somebody help you identify that you have a problem, right? Or be able to talk to somebody about whatever discomfort the person, feels, to identify where the problem is coming from. So in my line of work, research and seeing clients, I have met with a high number of women that they have, despite what we think in society that, women are able to talk about their sexuality, they are able to be, they are able to say what they want and how to get it and everything, all the above. We know a good number of women per research still have problem to, number one, understand that they have a sexual problem, to be able to identify it, and above all, to even talk about it, right? So I mean, the third part probably is the hardest part for women to do that. And so how do I know that? Because I have done years of research and I have collected uh, pages and pages and pages and pages of narratives of women's stories, that how they have talked to me voluntarily to share their life experiences with me, about their marriages, about their relationships, about their upbringing, about messages, the do's and don'ts of the cultures, that how shaped them to be the woman that they are, or they have been at their present time, at the time when they were talking to me about their life experiences. And about their marriages, about their relationships, intimate relationships, that how many of them would believe that they know all about intimacy and all about what a sexual relationship needs to be. They find themselves surprised, with their actual experience of it. Or how many women, believe they know about sex and all of that, only to walk into a relationship and again become surprised. There have been women that they were, sexually abused and they were not aware that they have been sexually abused. So there's a lot to talk about this topic, and then we have our break coming up. So let's just take a break and get ready so we can open up this very interesting topic and what comes with it.
And
right
please,
after our commercial break. Yes.
Yeah, call us 951-922-3532.
Yes.
We'll talk to you in a moment.
Heart to Heart program. For those of you who are joining us at this time, welcome, first of all. And we're talking about how to help women overcome their sexual difficulties in a society that we believe is open to discussions, but actually, guess what? It's not really. And so please call us. We would like to hear your story, because your story offers us such valuable, information that we never had before. And those stories are so much important, because they're going to help us to, help thousands of other people, if not millions of other people who share similar experiences with you. Our phone number live here is 951-922-3532. You can also contact us via our private information, which are displayed on the screen at this time. And also, we can also go to our archive program, so that, if you're interested to listening to our prior shows. So welcome back, Dr. Jaffe.
Thank you.
We were talking about how, talking about sexuality is different and difficult for women versus men, and how women, when they are growing up, they receive messages about who they should be as a female, what kind of a role they should, assign to themselves, what limitations they have, and what is the definition of a proper woman, and what's the definition of a proper wife, girlfriend, sister, mother, daughter, and all of that. Basically, some of them, of course, are very valuable. I'm not questioning that, but many of what is offered in the name of protection, right? They're actually, limit women's ability to be assertive for what they want, in particular when it comes to their sexuality, right? So that's, the part that stays with women at such an unconscious, subconscious level, that a female may not even be aware of it, that they have any, sexual difficulties or challenges or discomforts, or even how to be expressive about, their sexual experiences, right? There's so much limitations out there. I mean, life is not what we see on the movie screens. It's not what we see on commercials. It's not what we see on media. Those are only a small fraction of people. Majority of women are not living that way. Majority of women are so much surrounded by their own beliefs about themselves as a female, as a proper female, as a somebody that needs to follow the rules of, their immediate social system and the norms of that, that they seldom are able to recognize that in their most intimate part of life, they have a, problem. And my experiences, I have seen that even women have difficulty talking about each other, talking with each other about their issues, right? So taking that and uh, on the other side of the equation, physicians, healthcare providers, mental health providers, from my own research, the research of colleagues and everything, and literature review is out there. You can check it out for yourself. We see that, for example, in the United States, only less than 25% of physicians overall nationwide talk about sexual aspects of their patients. And we see
you mean with their patients?
With their patients.
With their female
with their patients overall. And then majority of that belongs to their female patients, right? So the less than 25%, includes both male and female, patients of all ages, right? So we have seen the rise of the significant rise of sexual transmitted infections and diseases, unwanted pregnancies, and all of that. And that's primarily where the focus of research has been. Seldom research has been, focusing on specific female, stories, specific female narratives of how they have learned to either limit themselves and or find their own way of expressing what's going on with them and how their sexuality is challenging for them. So when we interviewed physicians about why they are not approaching women in terms of their sexuality, they collectively, at least in my own research, and I see similarity between mine and my colleagues, that the level of comfort of physician is questionable for them. They say, we're not comfortable to do this. Or they are afraid that patients may sue them, or they're afraid that they may contract a disease, a sexually transmitted disease, or they don't have experience, or they haven't been trained, or their specialty is somewhere that they don't believe has anything to do with sexuality. Where in fact we know today that a female sexuality, when appropriately is not addressed, it can cause several problems in her life. We're looking at, psychological problems. We're looking at physiological problems. They are age-related issues. They are, immune system issues. They are postpartum issues. They are the quality of life issues. And, so sexuality is not just about having a good sex, it's not just having a good orgasm, it's not just, be just sexually active and you think that's it, right? The experience of, a healthy sexuality has far more health benefit than we can even, begin to discuss it in a few minutes. And that needs, conferences, and there are conferences globally that talk about the importance of healthy sex, right?
Correct.
So I have been working with physicians and psychiatry, mental health professionals, and I have dealt with female patients. On both sides, they are waiting for the other one to bring up the subject. Patients are waiting for the physicians to bring up the subject, right? Physicians are waiting for the patients to bring out the subject, and it's not happening. The end result is unhappiness, health issue, and the lack of, quality of life, right?
Right. So can you maybe say a little more about uh, the health issues that are related to women not addressing their own sexuality?
Well, we talked about, immune system,
Mm-hmm.
right? Heart disease,
Mm-hmm.
Even diabetics, we know that is part of it. We know that, when it comes to aging, we have issues right there, hormonal changes,
Mm-hmm.
not knowing how to address, and how to even identify those changes, unhappiness, depression, anxiety, stress,
Right.
right?
Right.
So these are just to name a few,
Mm-hmm.
right? When it comes to difficulty, and when we trace the source of all these conditions and uncomfortable conditions, we see that how uh, our emotions, our feelings, our unmet needs can impact our physics and then cause physical problems, right? That's
Right.
in short,
Right.
right? So for years, I have been thinking of how, now that I have done this research, what am I going to do with the result that I have found? Okay, both sides are uncomfortable talking about sex,
Mm-hmm.
right? Which we know that this impacts relationships, this impacts marriages, this impacts, again, health, condition, and the many times divorce happens. And so what do we do?
Well, one thing we can do that occurs to me right away is we can write a book about it.
We are.
I know.
Right.
That's
We are
why I brought
writing
it
a
up.
book about it. Yes. So we have two products to, introduce and to elaborate about, right?
Mm-hmm. Yes.
It took me 25 years to sit here today and to introduce, the product that I'm very much proud of to bring up to you. So anyway, a book. You
A
want to
book.
go ahead?
A
You
book.
want to go?
Well, I just want to
I'll
say
let you talk about the book.
I have an interesting title for the book.
Yes.
Yeah. How about if we call it "Not Tonight, Honey, I Have a Headache"?
Right.
And that's a book that you and I have been working on for over 2 years.
Right.
And we are not only going to publish the book, we're also going to create a course
Yes.
around it, which will help men and women learn how to talk about and embody their sexuality in a much healthier and much more fulfilling way.
Yes.
So that's what we're in the process of doing.
Yes. And this book is unlike any other book because we haven't talked about, just, you know, it's about the theoretical aspect of it. There are actually real life examples in it. They're actually, we're talking about the depth of points that it's uncomfortable to talk about,
Mm-hmm.
right?
Right.
But then again, if we don't kind of shed light on those, then how do we overcome them?
Mm-hmm.
Right? And even sometimes, I have said a few things in this book that I surprised myself that, and then I realized, what I'm writing or what I'm sharing with you are narratives that I have heard.
Mm-hmm. Right.
They're not just talk. They're actually real life examples.
Mm-hmm.
that people have gone through and have suffered through it and have been able to overcome it and live to tell about it. That's really, look at the depth of the struggle that
Yes.
a person has gone through in terms of their sexuality,
Mm-hmm.
and how we bring all that experience into our relationship.
Yeah,
Right?
and of course, uh, when people feel embarrassed, ashamed, um, guilty about the feelings that they have or the fantasies that they have, um, none of that gets processed through their authentic true selves. It all
Right.
goes underground.
Right.
And it has physiological effects, as you were just caught, but it also has profound psychological effects
Right.
in that people feel as though they shouldn't be who they are, and they shouldn't be fantasizing about what they fantasize about. Uh, yeah, a long time ago, there was a woman who wrote a book on women's sexual fantasies, Erica Jong, and it was amazing the kind of reaction she got, because this was like brand new, and that women actually have sexual fantasies, number one, and that some of those, what of those fantasies are. Unfortunately, it didn't go very far.
Yeah.
It went out. The book was published. It was a pretty well received book, but nothing ever became of it in terms of how we now educate people and talk about sexuality.
Yes, but thankfully we are at a better place today than then.
Mm-hmm.
And so our book is also has uh, tools to how to what to do with some of what we have included in the book, and how male sexuality contributes to not tonight honey I have a headache, how female sexuality contributes to that, and what to do about it. The other part that we are very excited to introduce is that in talking to physicians and mental health providers and women, we said, okay, well, we need to facilitate a form of communication,
Mm-hmm.
right?
Mm-hmm.
So I have been looking at the literature of all these sexually instrument questionnaire that they are out there, and they are great. I'm not going to say, many of them I've seen many of them. I've gone through many books with sexually questionnaire about female sexuality, about orgasm, about desire, about low libido, about fantasy, about you name it, they are out there, and every one of them have so much benefit and have brought so much benefit. However, none of them, none of these books have specific questions about female sexuality that was actually based on the narratives of women themselves. In other words, a group of researchers, a group of clinicians, they have sat down and designed questions based on what they believe is the experience of having or not having an orgasm for a female patient.
Mm-hmm.
They have sat down and they have talked about what does low libido may look like for a female patient. What does sexual abuse may look like for a female patient? What does postpartum may look like for a female patient, or what does aging may look like for a female patient. However, they are not based on what patients have reported. So, but because, I have been dealing with patients all across the past 25 years and have collected their narratives, I realized what was missing in the literature.
Mm-hmm.
And to me, to get to this point took lots of time, lots of studying, lots of listening, and lots of active listening, lots of looking beyond what the words have been saying and all of that. On both sides, both physicians, mental health providers, and patients, right? So it's not to say that it's patients, it's physicians or mental health providers' fault that they don't feel comfortable to do this, to bring up sexually related issues with their patients. It's because the same culture that runs me as a female, it runs them as a male or as a female provider of healthcare.
Right.
Right?
Absolutely.
So it's not like, they have a fault that they're not doing that. It's because they are also grown up, they were exposed, they got the same messages.
We all live in the same culture.
In the same culture. So just because they became a professional in healthcare, it doesn't mean that they are separated from that culture.
Well, yeah, also in terms of medical school does not really teach this.
Exactly.
So people become medical doctors without really taking any in-depth courses on sexuality, except with respect to reproduction.
Exactly.
Yeah.
And sexual transmitted infection and
Right.
diseases. So
Right.
more of this after our commercial break. Please call us 951-922-3532. We want to know what's been your experience of going to your physician or to your mental health professional and see who brought up the sex subject. Okay. Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at KMET 1490 AM, ABC News Radio Live. Our phone number here is 951-922-3532, and we would like to encourage you to please join us so we can have a dialogue going on, the discussion going on, and share our perspectives and learn from each other. And we want to learn from you. We are interested to know about you and your story, and we value that. So, and thank you. 951-922-3532. So before commercial break, we were talking about how to bring the physicians, mental health providers, and female patients together so that we can have a dialogue, about them, being able to talk about with each other so that, we can resolve sexually related issues, based on how women think, feel, experience, and ability to be assertive enough to share about that, with providers. So finally, we were able to, Dr. Jaffe,
we were
able to come up with a questionnaire. So we named this questionnaire the Rashidian Female Sexuality Questionnaire for Psychotherapy and Medical Practices.
In honor of my illustrious partner, Dr. Mitra Rashidian.
Thank you.
Yes.
Thank you. For short, we call this questionnaire TRFSQ because that's a better way of addressing that. And this questionnaire has 30 questions, and they go from the range of agree to highly agree to not agree at all. And they are very much easy to answer. All there is to do is just a check mark. And so this questionnaire is going to address a variety of sexually related issues. And the questions have been designed based on how women have reported them, which we know from clinical perspective where the question is targeting, what kind of an area of sexuality these questions are targeting. But when we bring it up to women themselves, they say, oh, they never thought of it that way. They didn't know, but that's exactly how they feel,
Mm-hmm.
So I know that the questions are genuinely designed and they are based on what women experience, not because how I feel as a clinician, a woman may feel. So that's the big difference right here. And I think this is what, is going to be a big help for both practitioners and female population to be able to understand really what's going on. And so how are we introducing this questionnaire? Well, we made it even more easy, right? First of all, the article and the research about this questionnaire soon is going to be published in the Journal of Psychosocial, Journal of Frontier publication, right? So it's actually, we have been invited to publish in 2 journals within this publication.
Mm-hmm.
and we are still debating on which one we're going to take. Right? They both sounds amazing. They both are such a, it's such an honor to receive the invitations, and it's so valuable to be able to publish in such a well-known, environment, scientific environment, and I'm really honored and thrilled to be able to do that. So, but you don't need to go and buy the journal. You don't need to be a member of the journal. You don't need to be a member of scientific world in order to access this questionnaire. Pretty soon, this questionnaire is going to be posted, online on its own specific website, which we're going to announce it when it is done. I think it should be ready within the next 2 weeks or so. And all you have to do is, as a female, if you decide to participate, you can go online and just no name. We don't need any name. We don't need any identifying information. All you need to do is just answer the questions. Give your demographic information, no name, and then you just need to put your email address so that you can receive your own results back. I even don't need to see anything. Your provider doesn't need to see anything. You get the whole thing yourself, and then you can get a printout based on that, because the whatever you have answered is going to be formatted in a PDF format, a PDF document, which is going to be automatically emailed to you, and then you can download it, print it, and take it to your providers, healthcare provider, and say, here are my answers. I need help with this.
Right.
Right. Exactly. It can get more easier than that, And then, so there are two aspects to that. If you just decide to, just answer it, have a PDF portion for that, you can, or you can have an online version. You can. It's all up to you. But nobody gets to see the result except you. And because why do I design it this way? Because it's you that's important to identify what's going on with you in a written format, so you can take that to your healthcare provider and then say, listen, these are my score, and I want to know why this is like that, because and here are the areas that I feel I'm experiencing, and these are my experiences, and I need help with that, and I don't know what to do about this. So if your healthcare provider is not able to help you with the answers that you need, I'm sure that they're going to be able to refer you to the appropriate, healthcare provider so that you can receive the proper help you have. And I have talked to a few physicians already, and they think that this is going to be such a valuable tool for them as well, because they don't have the comfort level to be able to, identify what a female sexual problem may look like, or the experience may look like. And we know that you don't have the comfort level also to go to your healthcare provider and say, guess what? I have never had an orgasm in my life, and I don't know what that is. Right?
Right.
Is that right? Yeah.
Well, yeah. I mean,
so
most women, at least here in the U.S., know what orgasm is, but there's still a lot of women who have trouble attaining orgasm, and certainly don't even bring it up with their partners.
Yes. But I like to make a comment here. America has a diverse population, and we see more and more. This diversity is increasing as we speak.
Correct.
Many of women who live here, they're not among the white population. Now, we know that population is far more open about their sexuality. But others who are coming from a diverse background, they don't have those experiences. They don't have that comfort level, or they don't have never had access to many of what, the main American population has.
Right.
So for them, having an instrument like this is essential, so that they can talk, that they feel permitted, they feel comfortable, they feel safe. Say what I'm feeling is actually documented here on the paper. What I'm feeling that I never told to anybody is right in front of me, and I can relate to this, and I can decide to say what is the degree of my experience here.
We've only got a couple more minutes.
We do?
Yeah. Perhaps you'd like to comment on some of these issues that the questionnaire addresses.
Some of those, sure, thank you. Some of the, like I said, women, experience variety of physical and emotional discomforts as a result of unhappy sexual life. I think that's the best way I can,
yes.
Put it. The same way, for example, if men have erectile dysfunction or if they have a premature ejaculation problem, how uncomfortable they are. But for men, it's much easier to go to the urologist and seek help for that. But for women, usually it's not that easy. But then again, we see some of the symptoms, and when we trace them back to find the root cause of it, we see that they are ending up with the sexual experiences, female sexual experiences. So the questionnaire, the way it's designed, we measure various, aspects of female sexuality that we see, unhappy sex life can manifest itself in high level of anxiety. Body, dysmorphia, changes in sexual, emotional, and, physicality of it. Early sexual messages, definitely shapes a female, sexual belief and awareness about and assertiveness about herself. We see emotional symptoms such as depression, such as, sadness, profound sadness, and anger, reactivity. There are so many things that can happen as a result of that, and women usually don't know where it's coming from. When women have a history of sexual abuse, we know that sexual abuse and sexual abuse has different meaning for different women. For a woman, even a sexual uh, molestation can have a lifelong impact on it. For a woman, another woman, a full rape may have a lifelong impact on it. But in general, go ahead.
Yeah, well, I was going to say I'd like to even expand on that, because even parents or other adults around girls commenting on their breasts, looking at them, as a sexual object, or even spying on them in the shower, things like that, are generally considered as sexual abuse, but still can be very, very damaging.
Exactly. So it doesn't need to actually be a physical contact to be called, sexual abuse, right? Creating discomfort around somebody's sexuality, just by like examples that you have said, it's definitely, an aspect of that. So level of comfort about, level of awareness about sexuality, level of interest about sexuality, and assertiveness, how to communicate about it, how to distinguish dysfunction, that somebody actually has organic problem with the dysfunction, whether mentally and emotionally have a difficulty addressing, or getting engaged in sexual relationship. How women kind of inhibit themselves about become expressive about sexuality, and how much do they know about that, and how much do they repress their sexuality because of the cultural do's and don'ts and other messages, and basically how satisfied they can be in their sexual relationships, and the fear and the phobia that they may have, and how much they're actually open to receive help. That's a very important part of female sexuality, because we know that the fear, the stress, the shame, and the guilt, and the sinfulness of talking or experiencing sexuality kind of inhibits many women to be open to even ask for help, right? So these are some of the factors that we are hoping that this questionnaire can open the doors for more communication. Therefore, we would like to invite you to please, when the questionnaire is ready online, to please just go for your own practice. And you're the only one who's going to get the answers. Nobody else is going to get the answers. Nobody else is going to see what your responses are. And get a printout and look at it for yourself and see if you want to, change something, if you believe you need to change something, if you have a different experience, we would love to hear from you. So we are at the end of our program, and we will talk more about this beautiful, discovery here. And I'm very proud of it myself, and I hope that, you benefit from it, and we will discuss it more. So happy Thanksgiving, everybody. It's a big celebration with the family, and be safe, be well. And until we meet again, all you need is love.
All you need is love.
Bye-bye.
Bye-bye.